Thank you. Can you hear me?
Yep.
Right. So, thanks for your time, everyone. I'm just going to be doing just a brief session today on respiratory protection and our experience and the methodology that we're using for fit testing, and just some of the issues that we've come across, positive and negative, that may assist other health services whilst they're preparing to do, engage people to do their fit testing and establishing their own programs. So our experience to date overall has been a hugely positive experience. It probably started back in February of last year with some very diligent and keen anaesthetists who were looking to be fit tested, either because they'd worked overseas and had experience in being fit tested, so they were very keen. So we responded very positively and assisted them. And during this space, it's been a very, quite an evolving space with fit testing, with the, positive outcome of DHS, approving and recommending fit testing for all health services. So our overall experience, again, has been with healthcare workers. They've been extremely grateful and relieved, showing much relief once they identify what respirators fit them and, give us positive feedback in that respect. Initially, we found, with regards to the variety and brands of masks that were supplied across the different health services, was quite inconsistent, and with only limited models providing, a successful fit. But as time has gone on, that has been narrowed down to much more successful masks and obtaining more positive fit test results, which has been very positive. I really need to say that there is no universal mask fit, and all masks fit different people differently, obviously, because different face shapes, different head shapes, nose sizes, male, female, it varies, gender, it's significant variance in the mask versus the person. So, and for that reason, that's why fit testing is super important to establish which masks actually fit which individual. The aim at the moment is to ensure that people get tested on at least 3 masks that are currently available at the health facilities, and that they pass at least 2 of those masks, and hopefully 3 or more. There was a couple of issues that we've come across over the time, and we've got to a stage now where decontamination procedures and cleaning procedures for the sample tubes has improved significantly over time, with being able to work with infection control departments and getting them on board in, the decision-making process in establishing, suitable cleaning and decontamination procedures. There were some fit test providers who had gone out and purchased, tubing from Bunnings or other suppliers, and were separating the twin tube. For those who don't know, there is a twin tube assembly that connects from the person's respirator. One tube connects to the person's respirator and the other tube is recording or measuring ambient particle counts and feeds it back into the porta count machine. It's critical that those tubes remain attached together, and that the validated methods from TSI are not, you don't go against those. It's super important for the final result of the fit test to ensure that, and the overall fit factor, to ensure that the twin tubes actually remain together, and that the tubing provided by the manufacturer is the only tubing that is suitable to be undertaking fit tests on. So I know that's been addressed with DHS and fed back through to the health services, so that's a positive outcome. Furthermore, another experience that we've had is that some healthcare workers are showing, and in the past have shown, poor donning and doffing techniques, which has led to sort of longer fit test times. But that again over time is improving, and the more fit testing that, the more training that is provided to healthcare workers, specifically on individual respirators, the better and the quicker the fit testing and the compliance with proper donning technique will be. All right, so the types of masks that are predominantly used in healthcare at the moment are those shown on the screen now, and that includes, you know, the 3M 1860, which has been proven to be a very successful mask. The 3M Aura, which goes without saying, has probably achieves the highest fit test rates, but unfortunately the supplies are very minimal, so we're using that sort of as the last resort if people don't fit other types of masks. The other one, which is the 3M 8210, it doesn't have the fluid resistance rating, so that's not as commonly used. And there's some other ones there. The BSN Pro Shield, again, good pass rates. The Haliad Fluid Shield, good pass rates. BYD, you know, about 50% pass rate, which is still a very comfortable mask and achieving reasonable results. And the DEP mould, which I believe was initially fit tested but not currently being fit tested in many health services. Other masks that are being used in healthcare have been, but to a much lesser extent, are these ones. So either a full face air purifying respirator, half face air purifying respirators, and the PAPRs are powered air purifying respirators. But at the moment, we're only fit testing the filtering face pieces, which are the N95s shown on the previous page. Most of you will probably already be aware of the different types of fit tests that can be used according to the Australian standard and international standards. However, I'll just briefly mention that the qualitative fit test shown on the left, which shows a hood placed over the wearer's head, and being fit tested there with isoamyl acetate or Bitrex or saccharin, so bitter or sweet solutions. This sort of method is a very subjective method and is not the method of choice for the current fit testing regime undertaken at health services. Predominantly we're using the quantitative fit test method, which relies on either a port account or an AccuFit, one of the devices, fit testing machines, which are basically particle counters that give you a calculated overall fit factor at the end of the person's fit test. The respirator training is probably the most critical part of a respirator fit testing program, and it's critical that participants, any healthcare worker or any other person being fit tested, is adequately trained in the use of the particular respirator that they're going to be wearing or even being fit tested on. The proper training and the ability to appropriately don and doff a respirator correctly has a huge influence on the overall fit factor results. And although during a fit test we spend, our organisation and most other fit test providers will be spending some time demonstrating the donning and doffing procedure. It makes it much more streamlined and easier and shorter timeframes if the healthcare worker has achieved prior training and competency assessment and are comfortable and have experience in at least previously having donned those respirators prior to their fit test. Training of the respirators must be on individual models and brands used and the different sizes that the people will be required to wear. It should be done, fit testing and training should be done prior to the fit test, not during the fit test as a rule of thumb. And the respirator training, should be in accordance with, the requirements of Australian Standard and New Zealand Standard 1715 and as per DHHS RPE training guidelines. So as just mentioned, it's critical to ensure that the fit test training procedures are standardised across all health services. So this is, I guess, the focus of the RESPFIT accreditation program, to ensure that all fit testers are training to a particular standard and that the methodology and the instructions are consistent, thereby minimising the intra-rater and inter-rater variation in fit testing practices across the various health services. As I mentioned, the quantitative fit testing is a preferred fit test method used at the moment for fit testing across the various health services, and fit testing also plays a very important and high educational value in fit test training. So the experience of the fit tester is critical, and in being able to provide fit tests and in passing on that correct information onto the candidates and the wearers. I'm just going to talk briefly about some of the factors that affect fit testing and the fit test pass. And there are so many variables that can affect a fit test. So it's very important to try and minimise those extraneous effects to achieve the best fit test possible for that participant. Some of those factors include the respirator model. So as mentioned earlier, there's no universal fit of a respirator, so different masks fit different people. It's critical that respirator size options are available. So if one particular size in a particular brand doesn't fit a person, then the more options there are, the more chance that they are going to be able to achieve an actual fit. The experience of the fit tester, as mentioned earlier as well, is critical to the overall experience and the conduct of the fit test, a successful fit test. Strict adherence to validated methodology. I can't reiterate any more how important this is, that validated methods are used and there's no deviation from those methods in carrying out a fit test, and also in the training of other people to carry out fit tests. Obviously that the deviation from those validated methods definitely negatively affects fit test results and pass rates. And there's also, as mentioned earlier, use of non-manufacturer supplied fit test tubing negatively affects pass rates and must not be done. One of the reasons for this is that although the size and the length of the tubing may be similar, it could be a different diameter on the internal part of the tubing, or it could be ribbed, which means that air can actually get through there, which would definitely negatively affect fit test results. So only use tubing supplied by the manufacturer to undertake those fit tests. Additional factors that affect fit test pass rates, include demonstration and clear explanation of fit test exercises. So the fit test operator should do a physical demonstration of the fit testing exercises and spend enough time explaining it at the start of a fit test and by standing up and carrying out those exercises and asking the participant whether they understood clearly those instructions, and during the fit test to repeat those instructions in between different exercises or prior to the following exercise commencing. Just as a reminder, those who are using the new port account, there is no display on the model 8048. The display is actually on the screen that the fit test operator is working on. So the fit test operator has to give those instructions to the fit test participant to ensure that they understand those instructions. And in the event that the participant is doing something other than what the required exercise instruction is, then the fit test operator can interrupt and tell them to correct that action. So, continuous close observation of the fit test participant during the fit test is actually very, very critical. That way, the fit test participant can be corrected if they do something that is inaccurate. Other factors that can affect the fit test pass is the quality of the mask, ensuring that there is no damage on the mask, and to ensure that the mask is a properly, standards approved, whether it's a NIOSH approved or an Australian standard approved mask. And making sure that always those masks are within use by date. So anything that's out of date should not be fit tested and should not be worn by anyone. The ambient particle count also can have an effect on fit test pass rates. So the ambient particle count, which is determined during every fit test, but also at the start of a daily check, it's critical that those ambient particle counts are suitable to be able to carry out a fit test. If the particle count changes during the day, then actions or troubleshooting should be undertaken to ensure that the particle counts are maintained within the standards that's required for the fit test. Furthermore, the position of the probe on the Pierce probe on the respirator plays a huge role in ensuring that a fit test is as good as it can get, and that the respirator has the best opportunity to fit on that person's face without any interruption from being, drawn or attached onto their skin, or being in a position where the tubing that's attached to it, dislodges or, breaks the seal on a person's face. Other things that are very critical is to ensure that the wearer or the fit test participant supports the twin tube assembly when they're doing fit testing using a N95 mask or P2 mask, to ensure that the hose doesn't pull on the mask and break the face seal. So ensuring that they pick up the tubing around where their waist or belly is and lifting it up slightly to give the hose some slack so it doesn't pull the mask off their face during the activity. And conversely, that when they're doing their various fit test exercises, whether it's turning their head or lifting their head, that their hand position should always follow their head, just like holding a microphone, so it doesn't actually pull off their face. Other things that can affect a fit test pass is obviously, as we mentioned, formal respirator protective training and education, and prior donning experience is very critical as well. Just showing you now the various types of respiratory protective equipment and fit test standards that are are available and we currently use to undertake fit testing. It's the Australian Standard 1715, which is selection, use and maintenance of respiratory protective equipment, Australian Standard 1716, the ISO standard, OSHA standards, etc. Now, the Australian standard actually doesn't dictate any fit testing protocols or specific instructions on fit testing, in particular for the port account or the quantitative fit test. Those are dictated by other standards, which I'm going to show you now. And there has been much discussion over the last few months with regards to what type of protocols or which of the protocols various fit test providers are using. So our team, our organisation at Hazard Alert, is currently using the OSHA, Occupational Health and Safety and Health Administration protocol, the CNC protocol, and we currently use the fast filtering face piece, which is the 4 exercise, approximately 2.5 minute duration test. This has been approved by OSHA and has been implemented and included in the OSHA standard. So it's an approved method, and it is, less than half the time of the original 8 breathing exercises that the OSHA standard had. So this is what we're currently using. Other providers, fit test providers, may be using other types of protocols. It could be the UK protocol, which is the HSC protocol, which is 7 exercises, either 9 minutes exercise, or there is also a 7.5 minute exercise, or other standards, the US or the Canadian standards. But we are currently, our organisation is currently using the 4 minute exercise. Okay. Fit testing, while we're fit testing, I think we all know by now why we're actually fit testing, but the most important thing is to establish which mask fits which people, and for peace of mind and to meet legal requirements. These are the various types of masks that we can fit test and are being fit tested, and it's important that, if people are using elastomeric mask, whether it's a PAPR, powered air purifying respirator, or a half face elastomeric or a full face mask, that the appropriate adapters are actually used for those masks. And just on the competency of a fit test operator, it's very important that a competent person undertakes fit testing and also provides the training for subsequent fit testers. And the fit testing requirements or the standards specify that the competent person must have the requisite skills and knowledge and experience to perform fit tests, be knowledgeable on the respiratory protection that they're being testing on. And a couple of categories of people can be, a fit tester could actually be an occupational hygienist, such as myself, or any other type of health and safety professional. It could be a healthcare worker with a required training who's undergone the appropriate training, or it could be an external fit test provider from a mask manufacturing organisation. The critical thing is that they undergo the requisite knowledge and training, and they have the experience to undertake such fit tests. I've just got some images here that show how we instruct on donning and doffing of respiratory protection and carrying out the fit test. So just, actual physical handling of the PPE and having a sample of each of the masks so the fit test operator can demonstrate the appropriate donning and doffing and checking of the masks. I'm not sure whether we're going a bit over time, but I will keep going at this point in time. A couple of reasons why respirators leak. Obviously, It could be a wrong size of a respirator, so it's very important that the fit test operator can observe the participant's face, the healthcare worker's face, and establish which sort of mask size would best fit them, and attempt to go with the one that they most commonly would use, or the most appropriate size. Also, stubble and beards have a very negative impact on fit tests and a pass rate. So our position is that anyone who has stubble or a beard or any type of facial hair must not be fit tested unless they are clean shaven. And there are some great posters around that can be used and as a reference point as to what is an acceptable facial hair. Clearly no facial hair is suitable, so unless it's like a small moustache or something that does not interfere with the actual sealing of the mask. Other things that can interfere and give us a negative result are people who smoke. So if anyone smokes within half an hour of a fit test, can produce particles from their expired air breath that can interfere with the results and give us a false negative. Furthermore, people who wear heavy makeup or powdered makeup, this is also a cause of particles being released into the respirator and then inadvertently measured by the fit test machine as a high particle count, which can also result in failed fit tests. Other things that can interfere and make a respirator leak are things like dentures, scars or moles on the face, acne, spectacles or other PPE interference, so face shields, glasses, goggles, etc. People who have experienced sudden weight gain or weight loss, if those can initially be found to have passed a fit test, and a few months down the track, if they've had rapid weight gain or weight loss, that can also affect their face fit, so may need to be retested. And obviously if a respirator is damaged, that can also lead to a poor respirator leak.
I'm just going to give you a minute warning.
Yes,
Mary, sorry.
That's okay. All right. I'm just going to flick through a few things here that just show acceptable facial hair and non-acceptable facial hair. So there are resources available so people can actually refer to them. If someone comes in and has facial hair, they can refer to a poster of some sort and decide whether that's appropriate facial hair or not. The instructions given to a fit test participant, it's very important that it includes things like fit checking prior to their fit test, and the fit checking is it's very important to make sure that the participant understands that that's not just for the fit test purpose, it's actually for every time they don the respirator. When they're wearing it, they must do a user seal check to ensure that that mask is in the best possible position on their face to be able to be worn and provide the adequate protection. Okay, these are just some images of the fit test equipment that need to be used. There is, you can't use a different type of alcohol. It has to be a minimum 99.5% isopropyl alcohol for the wick to be soaking in. Sodium chloride tablets should be used, obviously, for the particle generator, and not other alternatives. So always use the appropriate types of equipment as supplied by the mask manufacturer, the TSI port account manufacturer. Okay, so I'm just going to go through some of the instructions that we use in carrying out a fit test. The fit testing that, as I mentioned, that we do is 2.5 minutes, and these are the different exercises that the operator the fit test participant must undertake. and it must be consistent between fit testers and ensure that they carry out those activities as specified by the manufacturer and the OSHA standard. It's also very important to ensure that people who are being trained are shown the appropriate probing positioning of masks, because this can greatly affect the fit on the person's face and the final result. And finally, with our fit testing, we ensure, and across the board, people should be given a result sheet for each participant as they complete their fit test. They should be given a result sheet so it's clear to them which masks that they actually have fitted and which ones they have failed, and which masks there's been no test on. So as an interim report until they receive further reporting from their management or from the organisation conducting a fit test. So just finally, there's been a lot of discussion also on the processing of tubing. So we can talk about that further if you wish, but these are just some images of our procedure for cleaning the tube. Our process is to clean the exterior of the tube using Clinell wipes, and then following through with an alcohol wipe, and we use 1 tube per person, and at the end of the day we then insert isopropyl alcohol or ethanol, 70% as a minimum, through the tube and cap each end of the tubing and allow the alcohol to contact the inside of that tube for a period of 10 minutes prior to emptying that out. So I know this is over and above what the DHS requirements are, but it's very important that the fit test operator work very closely with the infection control department to come up with a methodology that is satisfactory to the hospital, the health service, and meets the minimum requirement or meets the requirements to ensure that there is no transmission or cross-contamination between operators. So, okay.